Dr. Rucker here. I have an excellent question that we will present as a seminar item. What are the commonly accepted doses and frequency for testosterone injections? So I asked ChatGPT this question, and this is what it said, and I'm going to narrate and comment. So testosterone cypionate is the most common salt that we use. So it typically has a half-life of 7 to 14 days. That means half of it's gone in that range for each patient. A typical dose you'll find in the community, AI said 50. It's usually 100 to 200 milligrams. Actually, 50 is also partly true. Some patients, their doctors tell them to inject 50 4 times a week. Now, the problem I have with that is all the extra trauma into each patient's muscle and the difficulty of doing that. And secondly, it's a molecule that's supposed to have a half-life of up to 10 to 14 days. It doesn't make sense to do it every day or every other day. So I've never been an advocate of that. I have our patients do it once a week at 200 milligrams typically, or 100 milligrams twice a week, because some of the patients will say they notice a drop-off in their symptoms, in their effects. So at times, we'll change it to that level of frequency. I think anything more than that is silly, but you see here, split dosing, 2 to 3 times per week. Some patients use smaller doses. I'm okay with it, and even subcutaneous, because the way we tell patients is to use it into the muscle. That's how it was designed. So if a patient really feels strongly and wants to do it that way, I don't mind, but it's not perfectly sensible. The best analogy I could give you is if you have a Honda Accord from the year 1990, and they told you that you're supposed to put regular gasoline. So I think almost most people realize if you put premium in, you're wasting your time and money. It's a similar analogy with the testosterone, that this is how it was designed, just like that engine was designed to take regular gas. So if you just follow the basics, you're going to be happier most of the time. But these are good concerns here. IM is the standard, but if somebody really wanted subcutaneous, fine. And then I've noticed after practicing 25 years that range of about 200 milligrams a week works. But when we check the labs on the patients, we look at their testosterone, their estradiol levels. We also look at the cholesterol levels and their blood count levels, and then we adjust according to that blood work. So that's an overview of testosterone injection, the dose and the frequency, and even whether it should be into the muscle or subcutaneous.